Welcome to Live Healthy Louisville, where we dive into the heart of the city's health and wellness scene. Brought to you by Results by Design Fitness, bringing you local experts, stories, and tips so you can live your best life right here in Louisville.
And we've got a repeat guest, actually her third time on this podcast, Foundations, Physical Therapy and Wellness, Dr. Allie Harper. Also my wife.
Yeah.
So good point there. And today she's going to be covering something that's hitting close to home to me because it's, in the past episodes we've talked about my Masogi, my goals for this year. She's directly responsible for helping me get through that, having a plan in place that helps me through that. And she's speaking to that audience today. So she's going to bring a physical therapy, a pain, a stability component to this running season that we're in right now. So excited to have Dr. Allie on and really dive into this topic.
Yeah, I'm excited as well. So, Allie, we are roughly 2 months away from the first Saturday in May, where a lot of eyes, millions of people are going to be tuning in to what's happening in Kentucky for the Kentucky Derby. Okay, they're going to be zoned in for 2 minutes. But what most people don't know that don't live in the state of Kentucky is that the 2 weeks leading up to that event is like a national holiday in our city with events every single night for those 2 weeks. And one of the really big events, it even kicks off a little sooner than that, is what is known as the Triple Crown. Okay, and the Triple Crown is not necessarily the horse race, but the Triple Crown for us in our city is a series of road races leading up to the Derby City Mini Marathon and Marathon. So that's what we want to talk a little bit about today. We know we've been doing this for a lot of years. As people start to get into running habits, they tend to start to have some aches and pains. And it's not necessarily that running is bad, right? It's just one of those things that oftentimes we're ramping up mileage a little faster than we should. We're not paying attention to the stabilization muscles and things like that happen. And then we're also, we just have a natural tendency to go too fast. So what are some of the things you see with runners that are leading to, some of these injuries as they get into this season?
Well, I think in general with the Triple Crown and with KDF half and marathon, a lot of people are doing their first race ever. So these are people going from like couch to 5K. Maybe they're using a generic training plan. Maybe they're ramping up. They're running in January, which is, about 4 months out from like the half and the full, but only like 2 months out from the first race. So I think the biggest thing people make the mistake of is understanding where they're at from a baseline, and then they're tacking on volume and intensity to a system that's not adapted to those loads yet. So I think it depends on your entry point and where you're at with, your running career or your running experience. But typically people get into trouble when they layer in intensity too quickly. And I think that's what people think they need right away is running where they can't speak. They're out of breath the whole time. They just think they need to go crush every single run. They think, if I'm not running the entire time also, then I'm not getting out of the training what I should be. And so understanding like meeting you where you're at is really important. I think that's the value of having like a personalized running program versus like a Pinterest couch to 5K, or I guess now probably more like a Chat GPT couch to 5K, because Chat doesn't know your injury risk, your history of injury, your training age, have you ran before, have you raced before. It doesn't know your job stress, your life stress, how you're sleeping, all those things either. So I think that's where it's valuable to have like a personalized plan.
Yeah, like you said, adaptation. So Chat doesn't know your current level of adaptation or where your body is currently, and you use that key word that we always use is meeting someone exactly where they are. We've had people that come into the gym that have had history of running, but it's, they're 5 to 10 years removed from that, and their body has gone through a lot of changes. They made it past COVID and then started to live a sedentary lifestyle, or maybe they've had injuries or knee or hip replacements since then even. And we've had people that come into the gym and they feel so good during their first few weeks of training that all of a sudden they go right back to the same running intensity that maybe they had before they let all of that go and their body adapted to them being more sedentary or putting a pause on running for the time being. and their bodies weren't ready for it. So we've had members that were like, hey, I felt really good after my workout, and then I ran 3 miles afterwards, and they haven't ran 3 miles in a decade, and all of a sudden they're injured. Whereas before, they were coming in with maybe very even limited contraindications, but they hadn't allowed their body to readapt to that new stimulus of running, because like you said, it's a lot of impact, and your body, some people have to go to couch to 5K in order to level up to those areas that you can't just go full speed right out of the gate.
One of the quotes I used to tell a lot of clients and stuff, especially early in my career, is that you don't run to get in shape. You get in shape to run. And I think, especially as we're talking about ramping up intensity a little too soon, we have these people that have done that, and myself included, right? I'm by no means immune to this
same.
behavior, right? I'm capable and able of doing some things I used to do, and I have the power and the prime movers, but I don't have that underlying stabilization, right? And that leads to a lot of residual and afterwards pain. So let's talk a little bit. Let's unpack, like, what is Dr. Allie's, like, if we were wanting to train smartly for this Triple Crown event coming up here in Louisville, like, talk to us a little bit about what that would look like.
Well, again, I think it depends where you're starting. And I think too, it depends what's the end goal, what's the training goal. So if it's just the 5K, this is going to look a lot different than what you're training for the full or the half. From a training plan perspective, from a progression perspective, from a volume perspective. So training smartly, I think you need to really have a hold of some kind of training style. So a lot of like distance running especially, is kind of zone based. You can go for like the 3-zone model. This is going to be like zone 1, 2, 3 training, and then some use the 5-zone model. Again, it's just a difference in like percentage of heart rate per zone and what you're training at, and then percentage of VO2 max sometimes, and then really it's perceived exertion as well. So you could just use the RPE scale, so rating of perceived exertion. Having some kind of measurable metric that could be also heart rate is another measurable thing you can use that sometimes going to vary a little bit more too, depending on temperature, recovery, how hydrated you are, how well you slept the night before. So it's not always a direct measure of true effort. So using the RPE scale, how do I feel on this run? Can I speak in clear sentences at an easy run pace, or am I gasping for air and can barely talk in, one-word phrases? Then that's a high intensity, right?
That's me.
Yeah, well, that's a lot of people, and I think that's where people get stuck, is they do every run there.
Yeah.
And really, we need to have maybe 20% at most, depending on your training age too, like how long you've been running. You don't need a lot of that stimulus. You really don't need that to make a change or an adaptation. Like, the lower your training age, typically the lower stimulus you need to get some kind of measurable adaptation. That's why like elites, like Olympians, professional athletes, like they have to pull every single lever to see like minuscule changes. So it's different for the average, amateur runner. But again, it just goes back to what's the goal. So for 5K, being smart about that. Typically, if you're a new runner, I'd say having a plan where you're not running on consecutive days is a good way to make sure that your tissues are keeping up with the loads we're placing on it. So we get into trouble with like bone injuries and tendon injuries when there's like a mismatch in that. So there's a mismatch in micro damage and stress that we're placing on the body and the body's ability to recover and adapt from that. And so then we get into this like continuous breakdown phase, and there's never this remodeling and recovery phase because you're just adding so much stress too quickly. So there's the biomechanical load piece of things, but there's also like the physiology too. So do we have the tools or the, I guess, just the things in our system like fueling, calories, carbohydrates, hydration, sleep, all of the building blocks to be able to recover from a biomechanical stress. So you might have the perfect training plan. You might be running on non-consecutive days. You might be only doing 20% high intensity of your total like weekly volume, and you still get hurt because, again, you might have underlying fueling issues. You're not eating enough. You're not sleeping enough. You've got little kids at home. You're waking up frequently throughout the day. You hate your job, vitamin D deficiency, whatever it might be. So those are all factors that I think should go into a training plan, like no matter who you are. And then just allowing time too, because I think people too think they can go from couch to 5K in a month, and it's like tendons and bones have a lag time of when they adapt. So bones, typically we might start to see kind of like a 3 to 4 week lag time of when that remodeling is starting to occur. And that's why you might see injuries pop up after like 3 to 4 weeks, a month after you've ramped up volume or intensity as well. And so a lot of running plans, you'll see that built in. You'll see like a down week built in. And that's intentional to allow the body to decrease from like a ramp in volume or mileage or intensity and allow that down week for you to recover. And that's intentional. And most people think it's pulling back or you're being lazy or whatever, but it's intentional so that your body can recover.
Just being on your program now, this is my third time completing a program created by you. I think a lot of people can resonate with me as far as where they're coming from running. I wasn't a runner. I saw running as a punishment because I played sports all growing up. So it was our conditioning. Knowing what I know now, I'm like, oh my gosh, what a joke that we were doing, just running long distances for solely our conditioning. That's a different story. That's a different podcast in and of itself. However, I think a lot of people can resonate with my story of going from, I was that couch to 5K person early on. And, sometimes it felt like I was taking it slow. Or when running with you and our sister-in-law, Madison, you guys were further along in your journey. So there were times early on where I'm way in the back. You guys are a half mile, 3/4 of a mile ahead of me. And that was okay because I was following a plan and I was able to see the benefits of it as I was able to build up that volume, as I was able to build up my conditioning for the specific adaptation that you were trying to achieve. And then I saw the changes over the years. Like the second year that I did it, I was near the front of our running group, and I was able to PR all of those little races that next time that I did it. And then, after taking a year off, getting back into the routine and not being as organized and as detail oriented as I had been, seeing some of those times drop off and seeing how long it took for me to build that volume back up, to build that base back up. Now going through it for another time here, during this running season, leading up to this Triple Crown, leading up to this mini marathon, I've noticed a big difference in the way that my body is recovering. So I think all of those variables that you mentioned, people oftentimes neglect. And, a really good coach, a really good physical therapist can read the way that their patients, their members are coming in and the way that they're presenting in the moment, but we don't know what's going on outside of the gym. We know our own bodies better than anybody. And the more that we build awareness around that, the more that we're able to continue to add these modalities in. So recovery, I found, has become a more important aspect of my life during this next time around because of what I learned about my body the last time, where I wasn't as detail oriented. I wasn't getting the multiple runs in a week at a lower zone threshold there.
Consistency, definitely.
Yeah, 100%.
I think people don't realize the importance of consistency at like low intensity is going to build aerobic capacity, capillary density, all those things that eventually do increase like your tolerance to run longer distances at a lesser effort. And those are things you can calculate too if you're not sure like what pace you should be running your easy runs at. Vaguely like a 50% of your max heart rate is 50 to 60% of your max heart rate is going to be like zone 1. But you can also, if you've raced before, there's calculators online where AI is a little bit more beneficial. You can type in like your 5K race pace, 10K race pace, whatever you've hit before, where that would probably be more of a zone 2, 3 effort. And it's going to spit out what your zone 1 would be, what your like repeat, your tempo, your threshold paces would be, so that you have a little bit more of like an objective thing to go by. And then kind of layering in like your RPE scale, meaning 0 to 10. There's different like modified versions of the RPE scale, but 0 meaning like you're doing nothing, you're sitting. 10 meaning it's like max effort. You'd want to be in like the 4 to 5 range where you can speak clearly at that easy run pace.
Yeah, and that's hard. That's hard for me sometimes because pride gets in the way a little bit, right? And you're like, no, I want to get this time. Or
Yeah.
when you see your Strava after your run, when you see your Strava stats at the end, and you're like, oh, I was above my what I want my race pace to be by a minute. Like, oh, I should be closer to that. But it does pay off in the long run. And although pride sometimes gets in the way, and I inevitably shoot for that anyway, you're always there to remind me, like, hey, you better be staying in your zone one. You better be able to continue that conversation while you run, because this is an important piece, and so is recovery. You got to make sure that you're fueling your body in the right way. You got to make sure that you're recovering and resetting and refocusing, so that you can go out and you can continue this plan, so they can get you ready for those moments. It's not about, sometimes that's just me being outcome focused, like we talked about on the goal setting episode, when I need to be process oriented. So there's a lot of people at home that are thinking, well, I have to complete the race, right? I have to run. If I'm going to do the mini marathon, I have to figure out how to run 13 miles. Now we got to figure out how to run one first, or maybe even better yet, walk one.
Yeah.
So it's important. You got to build these habits step by step, compound them over time, so that you can sustain this journey and not get hurt during it. Because you get hurt during it, none of this matters anyway, and we're not going to be able to show up on race day.
Yeah. Oh, yeah. I'm glad you're taking notes. Right. So first and foremost, I'm glad you're listening over here. So, Allie, I think kind of the next thing I want to unpack, we're talking about running, and obviously people think to get good at running, you need to run. Mm-hmm. And that is true. But sometimes to stay healthy from all of the impact of running, there needs to be some other modalities. There needs to be some of that cross-training behavior. There needs to be some strength training come into play to keep us healthy. Now, I know the thing that a lot of runners have told me over the years is I'm running, so I don't need to train my legs, right? But I don't know that that's the case. What do you think?
No, I think strength training is necessary. A lot of runners have significant strength deficits, and so I have certain testing that I do, physical performance tests, functional performance tests, and kind of metrics that I want them to be able to meet, to say that you're not necessarily like at a significant decreased risk of injury, but we know that those tissues are at least tolerating like your body weight. They're showing good endurance, that kind of thing. So the biggest muscles that are demanded of during running are going to be the gastrocsoleus complex, the quads, the glute med. From like a muscle standpoint, those are going to be some of the biggest ones. And then those obviously impact like bone forces as well, which we can influence with strengthening certain muscles and doing certain types of exercises like plyometric type exercises and strength training as well. So those areas are super important to strength train. So generally, I want runners to be able to do at least 25 single leg calf raises, kind of as like a benchmark. If they're having pain or injury, these are things I use to kind of see like what the severity and irritability is. But say they have no pain and they're just looking for like a strength benchmark, that's a good one. A side plank test, being able to hold a side plank with a hip abduction, with that leg lift on top for 30 seconds. A lot of people cannot do that, but that looks at hip endurance, hip strength, core strength. And every single stride we take, you're in a single leg stance. So that really looks at that glute med, that side hip muscles, ability to keep you in a level pelvis position, an upright position. And if you have better strength in your muscles, you're also going to have better running economy. You're going to have stiffer tendons probably. Tendons store and release energy. So this just improves like the overall load to muscles, bones. Basically, you can run with less of a metabolic cost, essentially less oxygen consumption if you're more efficient. And why would you not want that, right?
Right.
So, yeah.
Yeah, sometimes inefficiencies or lack of muscle engagement shows up as a lesser performance, but sometimes it shows up as pain. And for me, there have been times where it's shown up as pain, or it's shown up in lack of performance, and maybe I ignored it at times. But when I did consult you, you didn't tell me to, well, go out next time you run, just make sure you engage your glutes better. You also didn't say, take a week off, take 2 weeks off, and then you'll be fine, and then just start running again. You gave me strength exercises. You gave me movement patterns to encourage engagement. yes, you did some manual work on me too, like you've dry needled me, and you continue to dry needle me, and I think part of it's you just like sticking needles in me, but
Oh,
no. So you find those specific points of resistance, but then also you do some testing that allows me to see exactly where my asymmetries are, and then you give me a roadmap with exercise. And the more consistent that I found that I'm doing my strength training program and doing my exercises in addition to my strength training that are dedicated to those areas of my body, the better I show up. And then the less that I've had, I'm a low back guy, my low back discomfort, my hip discomfort. If this resonates with you, a little bit of pain radiating down my leg, little heel and foot discomfort over time, little neck and upper thoracic spine tension that I feel on a consistent basis. But I get better by doing my exercises, not by doing nothing, and not by just figuring it out by doing more running and trying to squeeze my butt more while I'm doing it, or run on my toes more than my heel, or whatever the case may be. You got to get it right first. You got to remove the emergency brake, and then you can go drive your car.
Yeah,
yeah.
I think that's exactly right. And I think one of the things, Ryan, that I wanted to kind of ask you about real quick before we move from this is like, you just mentioned a lot of the common things that happen with people, right? We see a lot of that ITB syndrome. We see hips and knees, and you kind of briefly went through a few things like the glute med and hitting that side plank and different things like that. And, you know, I'm sure people out there listening, they're going to go try those things, right? They're going to get out there and go straight to them. And oftentimes people can muscle through those things, right? But it's the nuances. It's being in the exact right position to get that information to tell us like where we're going. And so I just want to make that part a little clear for people out there. And, you know, obviously, you know, Dr. Harper here, Dr. Allie, as I call her, would love to help you figure some of those things out. But I do want to like, tell us, you know, you were a collegiate runner. You've been running your entire life for the most part. So you've seen a lot more of these injuries than I have, probably than Coach Ryan here has. So like, what are some of those common ones? Especially, you know, I mean, we're just a day or two from the first race, right? The 5K is this weekend coming up. People have already been training probably since January, hopefully the first of the year, but somewhere in there, and they're starting to feel some of those things, right? So what are some of those common ones we see? And then the next thing I'll ask is, what can we do about them? But let's talk about what they are first.
I would say lower body injuries in general are going to be the most common for runners. And typically it's going to be a tendon type injury or a bone type injury a lot of the time. Okay. You can get into other like acute muscle strains and stuff like that. But if we're going to talk about tendons first, typical areas for this are going to be the Achilles. The Achilles itself takes on, I believe, like 6 to 9 times your body weight with every step. So it stores a lot of energy, takes on a lot of force. So you can have different types of Achilles pain, insertional Achilles tendinopathy versus more mid portion. That's kind of more detailed, not super important unless you're seeing a provider. Patellar tendinopathy, so that front of the knee pain, different than front of the knee pain that's caused by the joint itself, so it acts a little bit different. Glute med tendinopathy, another one, kind of that side of the hip pain, hurts when you lay on it at night. Tendons in general, I would say warm up with running. So you might feel super stiff in the morning when you wake up. Might feel better the more you move around. And then it's kind of like a catch-22. They can get fatigued and hurt the more you do as well. So I do see that a lot. It differs a lot from a bony type injury. So this is where it's really important to not just ignore things, muscle through things. Think that strength training is always the answer, because if you're dealing with a stress reaction of any sort, anything along the spectrum of a bone stress injury, this needs to be like very closely monitored, especially if you have had one in the past. So if you've had a bone stress injury in the past, I think for females it increases the risk, I think like 7 times. It might be, I think it's 7. I think for males it's like 5. Regardless, if you've had one in the past, that's one of the biggest indicators that you can get another one. And the difference between like a tendon type pain versus a bony type pain is bones typically don't warm up. Not always. They can warm up as you run and feel better, but typically they're going to get worse with weight bearing. This is going to depend on like what stage you're in of a stress reaction, or like what grade you're in of a bone stress injury. It goes from stress reaction where there's just like swelling around the bone to like complete fracture for like a grade 4. grade 4 plus. So that's important to know. You can't exactly see what grade you're in without imaging, which is also important as a provider. If you are having bony pain, they send you for an x-ray, it's negative, and you're still having pain that is similar to a bone stress injury, it doesn't mean just like throw that out, because a true like bone stress injury needs to have an MRI probably, unless it's a grade 4 already. It'll show up on an x-ray once it's a grade 4, which is a complete fracture typically. So with bone stress injuries in general, you're going to have pain over a bony site, worse with weight bearing, sometimes pain just at rest. That can vary too, depending on the severity of it. Tendons typically don't bother you at rest a lot of the time. They can if they're like really irritable. But that's just kind of the difference in the two there. Bone stress injuries in general, we can see a lot in the foot, the metatarsals, the posterior medial tibia, the femoral neck, the femur shaft, even the pelvis too, and the sacrum. And then there's different levels of those too, high risk versus low risk. So knowing that as well is important because the blood flow is different to different body parts, different bones. So that can impact healing. That could impact potentially how long you should be non-weight bearing, if you should be non-weight bearing. So this can be the difference in somebody like needing surgery or not, essentially. So if it's a high risk area that has poor blood flow, not as good like biomechanical advantage, and then also just poor healing capacity, then it could potentially need surgery. And if you keep running through that because you think it's a tendon injury, this is obviously worst case scenario. So getting somebody who understands those things, knowing what those behaviors are of those types of injuries, is really important versus just ignoring the signs.
When we talked with you about pain in general on your first time here, you described pain as a defense mechanism. And although we don't know why our body is signaling to us that pain, us in the moment, right? It's important that we outsource and make sure that we're taking care of that first. It's not as simple as muscle through it, like you mentioned. It's also not as simple as some might put it, it's just old age, or it's probably my arthritis, right? No, we need to figure out where that pain is coming from, why your body is signaling that defense mechanism, and then we need to attack it from that point so that we can eliminate the pain, but then also if that's something underlying, like why not fix it? Like we're not meant to, most of us are not meant to live in this element of consistent pain. We have to address it, but just like you said, you have to outsource it because otherwise we don't know why our body is signaling that. It's almost like you don't know why the baby is crying. You don't know if it's hungry or if it's hurt or if it's sad or if it's lonely or if it's happy. You don't know what's going on. You just know the baby's crying. We got to figure out why that baby's crying so that we can console it, whatever it needs, feed it. Same thing with our bodies. You got to figure out, and a lot of times that is seeking someone who can do imaging or take you through an eval or take you through an assessment, figure out why your body is signaling that, and then we have to fix it.
I think the can be summed up in a nutshell is just don't ignore your pain, right? I mean, it's a warning light, it's a check engine light, and it's telling you like, hey, now's the time to figure this out, right? You wouldn't get in your car with a check engine light and try to drive it at race car pace to Florida. Right? You'd probably do some maintenance on it first. And, I think that's what a lot of people tend to do, especially as they get into these races. You mentioned ego early, especially us guys, we tend to have a lot of that when it comes to events. And, maybe we're not trying to beat everybody, but we're trying to prove to ourselves we could still do those things. So we tend to work through some things. So I think the first thing is A, don't ignore it.
Yeah.
And B, like you said, let's outsource it. Right? If my car is broken down, I mean, I know how to do a few things, but I'm probably going to go get a mechanic. Right? So I'm going to figure out somebody that is an expert in that field. And that's where a great physical therapist could come into play. Right? So let's walk through a little bit. So I know coaching for a long time, the one that we hear a lot is, and I don't even know if it's still a common term, but ITB, the IT band, right? It flares up. It starts to cause knee pain. It causes hip pain. Walk us through, if I'm coming in to see Dr. Alley, and that's what I've told you, and my online paperwork or whatever it is, my initial paperwork, I told you that's what's wrong. Walk us through, what would that look like for somebody coming in? What are the things you're going to look at? What are the things you're going to test? And then how would you maybe address some of that?
Yeah. They definitely have changed terminology on it because it was called IT band syndrome, and syndrome's technically like a congenital abnormality that you're born with,
Okay.
and that's not
Yeah.
true. But it's kind of just known as ITB pain now, so iliotibial band pain. It's that outer knee pain. It used to be thought of as like a friction type pain, and now we know a little bit more just based on its attachment points that it's more compression based. Typically brought on in about like 20 to 30 degrees of knee flexion, which is pretty much what you're in running, can add more compression to that IT band site. And it attaches to the Gerdy's tubercle, so just below that knee joint, some attachments into the lateral retinaculum of the patella, and then even into the backside of the knee as well. So all of those can kind of be like compression sites of it. A lot of people like to get in there and foam roll the crap out of it. And I always tell people we don't want to compress a compressive issue. So foam rolling and adding compression to a compression issue can make things worse. With that said, addressing things above that, so the IT band it's kind of like a tendon. It's a storage and release piece of tissue, right? It's very strong, and it's meant to be stiff. So we want to probably address more so things around it, like the lateral quad, the glute med, the glute max, that have some influence into the IT band. But things that I would look for is that, again, that lateral knee pain, sometimes worse with like bending the knee, worse in that 20 to 30 degrees of knee flexion. So running brings it on. A lot of the time I'll see hip abduction weakness, hip external rotation weakness. So they're falling into more of that knee valgus position, which adds more compressive forces to it, or that like knee collapsed position essentially. So those are things that we work on. A lot of the time it's proximal strengthening, working on the hip strength, especially just because of the attachment sites of the IT band. But again, I'm usually not needling the IT band itself. I'm not massaging the IT band itself, not having them foam roll it, anything like that. Might be needling and doing soft tissue around it, but yeah.
The victim screams louder than the criminal.
Right.
Right? So we use that terminology all the time. Scott taught me that long ago. And oftentimes, it's not the exact point where we're feeling the pain that needs to be addressed. It's some of the tissues around it that can take some pressure out of that area, right? We use all these analogies to kind of break it down into layman terms for people so that we can address some of those things within our scope. Like at the gym sometimes, there have been times, I talked about myself being a low back guy. That doesn't mean that I have necessarily always a low back issue, and maybe that my glute is shut off for the time being. And so there have been times where I'm going to do a goblet squat and I feel some discomfort in my lower back. Put the dumbbell down. I go over and find a little lacrosse ball, and I set down on it in the center of my butt, and it releases my glute. And then all of a sudden, I go back to do my goblet squat, and the pain is just gone. I didn't fix my back. I just loosened up some tissues around that area, and I found the criminal, right? So that the victim was able to move more freely, which was my lower back in that example. But I think that's a good point that to make to people watching at home. Like your body, we're meant to look at our body from a holistic point of view, right? It's not just as simple, just like the example we used earlier, as it's not just as simple as, oh, you're just getting old or it's just arthritis. Yeah, those things matter, right? Like if you have arthritis, that's an underlying issue, and inflammation, as we understand, is going to be more present in those areas when we have it, right? But it's not as simple as it's just that's the way it is, and we just have to get over it. We can do some things to help elevate everything around our body so that we can take pressure off of those areas. So taking a holistic point of view, looking at the body as a whole, can sometimes help us maximize what we do have regardless of our circumstances.
Yeah, I think it just still comes down to like adaptability. What is the tissue ready for? And it doesn't matter what age you are. I mean, it might change the way that we would expect to see certain injuries, typically like tendon injuries. We see those as we age, just collagen changes and structure of tendons changes throughout the lifespan. But again, like your body's just responding to whatever its baseline is. So you just need to get it to be ready to adapt whatever load you're about to apply it to. And so I always look to, does the person have movement variability? And can they get joints to move in and out of the positions that that joint specifically is meant to move into and out of? If not, then that's probably going to shift loads up, down, side to certain areas. So we just need to ask, why is all of the force or all of the load ending up in the area that they're experiencing their pain? Is it something above and below mobility-wise, stability-wise, or is it wellness factors too? You know, there can be other things that aren't just biomechanical that can drive the body's inability to adapt.
Yeah, we're in the midst of this every single day, and you know, some of these terms and things that we're talking about make a lot of sense to us, right? But I know the listeners out there, it could be a little confusing, especially like when you talked. You just brought up the IT band. You don't actually treat it. You treat around it, right? And that's one of the things that I love the most about the way you practice, because you understand that. And a lot of people still are going to their practitioner and they got pain in their IT band. Well, like you said, let's foam roll it. Let's do this. Let's compress it and make it even worse, or not fix the pain, not fix the issue. Talk to us a little bit about that philosophy, because I know there's people out there listening right now that like that's confusing. Like, I'm hurting here and you're doing something up here by my hip.
Yeah.
Why is that the case?
Well, again, I think it just comes down to, why is your load ending up in that spot? For running, like if you have an acute calf strain when you're running after you like tried to sprint, then maybe it's not a movement variability issue. Maybe it's not even a capacity issue. It could have just been a one-off thing. So in that case, we probably will treat locally, right? We might needle the area to promote blood flow and stimulate healing of the acutely strained tissue. We might do isolated strengthening for the calf if like you strained your gastrocnemius, so your big meaty calf muscle you can see. But if it is more of like a chronic type issue, that's slow onset, gradual onset, maybe it's related to your movement mechanics. Those are things we want to dive into and see, like, how are you moving? Where can we make movement more efficient above and below the areas of pain you're having? Usually I look to see, like, if we do those in a session, does it change your pain immediately? Because then we know we are like on the right track. If I can do something with their hip or their ankle, mobilize it, create stability in that area, and then they're like, oh, my knee feels better, then we know that it's not a local issue. So educating the patient too and explaining that, I think, does get better buy-in so that they can understand that. And explaining too that just because you have pain doesn't always mean there's something structurally wrong. And I think that's more true if it's not always true if it's a gradual onset or if it's a chronic issue, because when you have like a bone stress injury, for instance, I mean, that could be a structural issue that gradually onsets. So that's not always you have pain, but there's no damage, because obviously there's damage with a bone stress injury. But I guess you probably get what I'm saying. Like, I'm losing my train of thought.
It's okay. No, I think you're nailing it. And I was going to tell Ryan, I mean, it sounds really familiar, because I think it's something you talk a lot about with our clients, right? It's the same kind of philosophy that we utilize in our training. You know, just because there's pain in one spot doesn't mean that that's the cause. You know, oftentimes what we've seen over the years, you know, if you have a joint that's aching, especially like your knee, that, you know, in our mind, because we use the joint by joint approach, we feel like that knee should be really stable. And oftentimes the hip or the ankle get gummed up, and that knee is the one that's paying the price. But like you just said, you go in and you mobilize that ankle, you mobilize that hip, and then all of a sudden the knee's better. Like you are on the right track. And I think that's what's so powerful about the way you look and assess and treat your patients. Right? I think that's one of the most unique things about you. Yeah, you have all the other tools as well. Right? You have the dry needling, you have the cupping, you have the soft tissue techniques and the testing, but you also look at the big picture.
Yeah, and those things matter. I mean, I love needling, I love the passive modalities, but I think a lot of people only want that. And dry needling, massage, soft tissue work isn't going to drive adaptation in your tissue ultimately. Like, it's not going to add stress to your body so that your body has to respond and become stronger. And most people don't want to hear that. Now, if it's somebody who's like got a race next weekend, I probably don't have time to make a true like physiological adaptation, get them stronger, maybe a little bit more mobile, maybe a little more stable. But like if they're racing in 2 days, like, and they just need to feel better, I'm going to use dry needling. I'm going to use soft tissue, whatever it takes to like get them to feel better and get through the race. But say they're off season, like, and they're like an athlete, or they're off season and maybe they don't race till the fall or whatever, that's a good time to like break down things biomechanically, dial in things like nutritionally, maybe look at their labs and see like what is driving those pain spots.
And we see, you know, obviously pain is in our scope. Movement is within our scope, though. And, you know, to use that knee example, you know, we've had members come in and they say, hey, you know, I've had this knee pain, but my imaging came back normal. My ortho says I just need to strengthen it. So he told me to do some leg extensions. And that's great and all, right? You're probably going to build up a lot of tone right there. But if I can help you move better, it's not necessarily just the tone that you have here, it's where your load is being shifted, just like you said, right? So, you know, oftentimes I can make your core a little more stable. I can give you a little bit more control over your pelvis, and all of a sudden you're getting those hips into a better position for a squat, which we do a lot more often in life than we do leg extensions. Actually, I don't know the last time. Usually the recliner helps me get into that position, and I don't have to lift weight with my leg, right?
Yeah.
But just so people get the gist of things, right? Like, movement is medicine, motion is lotion, but the right prescription of movement is medicine. The right amount of motion is lotion. And so we have to help you move well so you can move often, like Scott has said over and over again on this podcast. It's not as simple as, let's just make this particular one little area of your body as strong as we can. Yeah, that'd be great if we could do that in every little area where you might have pain. But we have to move well. We have to help you get your body in the right position so that you can shift loading, so that your core can connect your upper half to your lower half and can all move as one unit. So regardless of what position you get your body in, you're using it all together, because we're going to have to bend over and pick something up off the floor. We're going to have to squat because I'm doing it now. We're doing it in so many different aspects of life to drive into the studio today. Seated for, you know, most people 12 to 16 hours a day. Getting up and down off the toilet even. Like, everything that we do in life requires us to get in these positions, not just isolate just the muscle itself. We're training movement. We're not necessarily training muscles. So just kind of tying all of these aspects, the training aspect, the physical therapy aspect, like, none of this matters. None of what we do, the dry needling, the cupping, even the exercises, none of that matters if we can't replicate it outside of the clinic, outside of the gym. So that's what we have to do. We have to help you get into these positions a little better, utilize your body so that it gets into these movement patterns, gets into your running pattern, your running gait a little more efficiently, so that the load isn't shifting to somewhere where it shouldn't be.
I think too with that, I mean, I will say there's certain situations where you do isolate things. Yeah. So a specific tendon issue, like patellar tendinopathy, or if you're really trying to isolate a certain tendon or a muscle, we know certain exercise elicit higher EMG of that muscle. So like, if it's a patellar tendinopathy, I probably am going to have them do knee extensions, just as one example to play devil's advocate. But for an Achilles tendinopathy, like, probably going to have them do isolated single leg calf raises. If it's a glute med tendinopathy, you're going to isolate the hip abductor muscles to get that tendon, again, to be under strain, under stress, because that's how they adapt and change. But that's, again, why you should be getting it evaluated by somebody who understands that, depending on like what stage of rehab you're into or what stage of pain you're in. Like, somebody comes in with 7 out of 10 pain and they're super irritable. You know, a lot of people like to say that PT stops, you know, before they should, or we don't integrate like specific strength and conditioning principles. If somebody has irritable pain, it's coming on with them lifting their leg on the table and it's not going away for an hour session, I'm not going to have them do 70% 1RM strengthening exercises at that point. But later in rehab, you should. So that's when those like other exercises come into play, when you're trying to get like true adaptation. And that's important to know, like, where are they at in that stage of pain and that stage of rehab? Are they in the pain management? Are they in the like reintegrate movement, like retrain their movement pattern? Or are they in the like remodeling strength and conditioning phase? Because you need to go through every single one.
Yeah, I think the tension is that, you know, a lot of people say those things because, you know, isolating those tendons, isolating those muscles, joints, whatever it may be, is important in the beginning. But I think that's where a lot of treatment stops.
Yeah.
There is no integration back. So just because somebody's out of pain doesn't mean they move well enough to get back to doing those things without exacerbating the same thing.
Yep.
So, and which is perfect timing, because you read my mind. It's like, it's what I'm going to bring up next. I mean, I'm not, but there's a lot of people out there about to run this weekend. I'm not, but there's a lot of people out there about to run this weekend, right? They've been training for months. And after this weekend, there's 3 more races to go. If you're doing them all, the Triple Crown, so if you're doing the 10K, the 10 miler, and the mini or the marathon, you got 3 more races. I'm already starting to have a little bit of those aches and pains. I don't really want to stop. I've worked my tail off. It's not so bad that it's making me stop, but I'm already hearing the warning bells.
Yeah.
Right? How, what would you do? How could you help? And obviously I know it depends, but like walk us through some scenarios. Like, do I still have time?
Yeah, for sure. I think, again, depends, like nuance. So if it's a bony type issue, so things that you can look for like red, yellow, green light warms up with running, doesn't linger past 24 hours, like it's not worse the next day.
Let's start with that. Sorry to interrupt, but
Okay.
let's start with that. Let's pretend that's where we're at, because I think that's where a lot of people start.
Lingering.
Right? Well, it's one of those things that it's like you wake up with it, but as you get moving throughout the day, it gets better, so you don't pay any attention to it. But then oftentimes when you do more than you should, it kind of comes back.
Yeah.
So let's talk about that one, because I think that's probably obviously without a acute direct hit, that's probably the first thing that happens, right?
Yeah.
Maybe not always, but a lot of the times.
I would say too, like if you are running with the pain, you're waking up with it, you need to know the behavior. So if you're running and you're starting and it's getting like above a 4 out of 10 pain and it's not going away, then that could either be a really, really irritable tendon or it could be a bony issue. So generally, if it's less than 5 centimeters of tenderness over a bony spot, I'm more concerned for it being a bone issue. So can you push through it was your question.
Yeah.
I would be very conservative.
Okay.
I would pull back on volume, probably intensity first and then volume. I would be running on non-consecutive days, not pulling the complete lever, like of saying stop running, especially if it's a tendon issue. So more than a 5 centimeter, like a house key size area of tenderness, not isolated over a bony spot, warms up with running, doesn't hurt at rest. You could probably push through that. And I'm typically okay with like 4 or 5 out of 10 pain. Bony pain really should not be more than like a 1, honestly. But either way, like you can probably push through more of the tendon pain versus bone. You can still, I would manage something like load management if you're trying to just get through it. Pull the intensity first. So have like 1 session a week max of that like higher effort. And if it's bringing your symptoms on and you're really close to the race, you probably don't need it at all. So if you can get through easy runs with less pain, probably a better indicator than in more intense runs without having to fully stop running. But yeah, you just want to be careful because if it is a bone stress injury, you can progress it. Like you can start at a stress reaction where there's just swelling around the bone, but if you keep running through it, it can progress, to a full fracture. So obviously that'll keep you out a lot longer than we want.
So you mentioned bringing back intensity. So maybe, at the very least, you just ran the 5K, the 10K, let's just ease through it instead of trying to hit a PR, right?
Yeah,
Especially if you're already starting to feel those pains, because you still got some time. You still got 2 races left. So, and you gotta survive the day in order to move to the next one. So,
Yes.
maybe changing that volume up a little bit. What about coming to see you? Would that be helpful?
Yeah. Yeah, to at least get a grasp on like what tissue is it?
Yeah.
And is it something you should continue to push through and see somebody earlier than waiting? Especially if it has become more of like a subacute thing more than like 2 weeks, 3 weeks, and you do have all these races coming up, like go get it checked out. Obviously I'm biased towards PT, but any rehab professional that understands the demands of running. So you can go to a provider too that doesn't understand that. They don't know the risk factors that, predispose you to a bone stress injury. They don't know the grades of a bone stress injury. They don't know the severity of it. And they could completely miss it. And those go missed for months a lot of the times. And that's why they end up being as bad as they are. So I would just say, get it looked at sooner than later. I mean, if it's a tendon issue, you can push through. If not, then.
Oftentimes with the movement and the pain elements of our body, it's something for some reason that's just in our society has often been neglected, which is sad, because it does need to become a regular part of your routine, right? These exercises, these modalities that you share with people, it needs to be a regular maintenance. Like we have and I think I've mentioned her before, but a sports performance a young sports performance girl that was coming off of a knee injury. And she, knee injury, physical therapy, and then was introduced to us through her softball team at Results by Design Fitness for some sports performance training, which is great. She's done a fantastic job until Christmas break hit, and we didn't see her in the gym for 2 weeks. And it wasn't necessarily the fact that she wasn't in the gym. I think that played a major role too. But when she wasn't in the gym, she also wasn't doing her physical therapy exercises. Mm-hmm. And so when I approached her about it, and her dad was listening too, and we ended up making a joke about it, I said, hey, you told me your knee's been bugging you, and I'm fine to kind of, deload you a little bit today or figure out, build you back up some with your training program, but have you been doing your physical therapy exercises? Mm-hmm. Well, no, I haven't done them in a while. I was like, well, when have you been doing them at all? And she said, when my knee hurts. I said, what happens when you do them? It feels better. I said, okay, so maybe if we did this on a more regular basis, maybe your knee wouldn't bother you.
Yeah, just basically detraining and then spiking the volume again. But I would say too, there's ways you can shift biomechanical loads a little bit with shoes and terrain. So if it is more of a thing that your provider thinks it's okay to keep running through, like heel pain, for instance, like Achilles tendinopathy pain, doesn't like to be in excessive ranges of dorsiflexion. Usually, if it's mid-portion, meaning it's more like if you squeeze that Achilles and that's where your pain is versus where it attaches to your heel, it can be a little different, but running in a higher drop shoe. So most shoes, if you look at the specs online or you go to a running shoe store, they're going to know that. So like a 8 to 10 millimeter or higher drop shoe is going to decrease your plantar flexor loads, so decrease that tension on your Achilles tendon. Now, other side of that, it might shift loads up towards the knee. So if somebody goes and they have knee pain, patellar tendinopathy type pain, or patellofemoral pain at the joint, then we might want to put them in a little bit of a lower drop shoe. Just to kind of shift the loads. I always encourage people to vary their shoe wear too, so that you're not running and walking every single day and the forces are going in the same spot every single day. This goes the same for like hill incline running. So if you have really acute flared up Achilles tendinopathy, you shouldn't be doing hill repeats in racing flats, right? That's going to add a ton of strain to your Achilles, more ankle range of motion. Flip side, if you're going downhill, that's more knee stress. So if you have knee pain, flat level ground, even the slight incline can help the knee. So if you're running on the treadmill, I'll have people usually do that if they're having some acute knee pain, put 1% up to like 3% on your treadmill, controlled environment. You can control the grade the whole time, and that can decrease knee loads as well. So there's different ways to do that. Typically, the higher up you get in the chain, the less biomechanical forces matter, just because they start to spread out amongst a lot of joints. So if you have if you're a runner and you have unilateral one-sided low back pain and you've had like a bone stress injury, there's different types of bone up in the sacrum and the lumbar spine too that are a little bit more metabolically demanding. So they might be influenced more by like underfueling versus biomechanics. So people worry about their foot strike and they worry about their stride length and their form first, but sometimes it has nothing to do with that. So just going to somebody again who understands that is really important.
No, I want to unpack that. Okay, because I was about ready to tell everybody like, hey, these are the 3 steps to have a healthy running career for the Derby City, but you just said something about joints not responding or becoming inflamed or having increased demand due to underfueling. Yeah, tell me a little more about that. That's interesting because I love nutrition.
Yeah.
Right, so that piques my interest, and I know a lot of people out there. They often run as a form of weight maintenance or weight loss and things like that. So even though I don't think that's the way to do it, we should be fueling our body to get through these races. So that creates a tension.
Yeah.
And maybe even a tension in your back.
Yeah. Yeah, exactly. So specifically like your sacrum is made up more of spongy bone versus cortical bone, which is detailed, but it's more metabolically demanding. So if you're in an underfueled state, then that bone might break down more than like your hard cortical bone that's in different areas like your shin. And those are also like low risk bone stress injury sites. But if you're running for performance versus weight loss, I think that matters too, to differentiate those things, because running in an energy deficit, meaning you're under eating in a calorie deficit, your performance is going to take a toll. There's some studies too that look at like, I think it's race walkers, or like speed walkers. And they did a group that they were adequately fueled calorie wise, but they were eating a high fat diet versus low carb. The other group was technically like in an energy deficit, so under caloried, but a high carb, so adequate carb. And that group performed better than the low carb group, even though they were adequately fueled calorie wise. So carbs definitely have a performance benefit. I think for marathon too, being in that carbohydrate fueled state improves marathon performance by like 2 to 3%. So we know that too, and based on intensity, that changes too. So if you're in an easy run that's 30 minutes, you may not need you definitely don't need the same carbohydrate intake as you need for a hard long run session. But either way, I think the one study too, you had to be eating 8 to 12 grams per kilogram of body weight the 1 to 3 days leading up to your performance to see those performance gains. So you might think you're eating enough carbohydrates, but you're still like, say you're at 5 grams per kilogram of body weight, you might not see those same performance benefits. If you're eating or, running for weight loss, this is different. But I still think you just need to know what your training goal is. Are you trying to perform the best, or are you trying to lose weight where maybe you do need to be in an energy deficit, but knowing what those risk factors might be for bone health especially.
It's easy for me because I just have, I'm with you obviously on a consistent basis every day. So I always get these constant reminders to fuel my body in the right way. Or if she knows that I'm going out for a longer run, like, hey, you better have 2 of those little carb shooters, whatever they're called, for your runs today, because you need to make sure that your performance doesn't decline in the midst of it. Something simple right here. If you think about, like for our athletes out there, if you think about your free throw in the beginning of the game, right? When you're less depleted, your form looks a lot better, right? But when you're tired and you're depleted and your body is super fatigued and there's sweat dripping, it's the fourth quarter, it's really hard to have that same great form, and a lot of great free throw shooters might miss in those situations, right? So if you think about it in that aspect of things, if your jump shot, if the flick of the wrist, if that type of performance can decline in a depleted state, my gosh, think about what your body's doing in the midst of running a mini marathon or a hard race where you're running at a race pace and trying to get maybe a personal record or beat the person in front of you. So it makes a lot of sense, but when you break it down like that, it's very eye-opening because it's just second nature to me. Like I said, I'm just like, oh yeah, I know Allie knows what she's doing. I trust her. That's part of the reason I married her, and I'm going to do those 2 carb shooters today. But it makes a lot of sense.
I think you just should be fueling for all your runs, even if they're easy runs, and that changes based on training demands. So I always ask people if they have ramped up their training, have you ramped up your fueling to accommodate that? And if they don't know the answer, they say, oh, not really. Well, that's probably a problem for injury prevention, number one, for soft tissue and bone healing, and then also just like optimizing their performance. And if you're ramping up your mileage, you're ramping up your intensity and your training, my guess is that you want to perform better. So sports dietitians are going to have like better specific numbers on those things, but it depends on intensity again. So like easy runs, you're going to get like 50-50 carb, fat, fuel utilization. And then as your intensity ramps up and your duration ramps up, you're going to need more carbohydrate intake. And hydration is important for that too, obviously.
That's so good. I'm glad we got into that part because I think that's so important, especially as we go into this season. I think there's a lot of confusion and,
fasted training.
Right. Yeah. A lot of confusion around running and weight loss and running and fueling and trying to hit PRs and all of those things. So I think that was really good stuff, Allie. So thank you for sharing that. So I think just as we start to wrap up, I think kind of some of the things I'm thinking through here is like, one of the things, just kind of bullet points for everyone out there. So first, let's not ramp up our mileage like blindly. Like let's have a well thought out plan that's proper, progressive, right? That's actually planned. We're not just going out one day and running a long distance as fast as we can because we feel great, right? We're doing it based on an actual structured plan because when you feel great, yeah, it's easy to run, but you still got to run the next time, and you're probably not going to feel great if you did way too much, right? Number two, strength training, right? I think strength training is super important. You kind of alluded to that, how it's important, especially with those hips, those stabilizers, our core, all these things we talk about with clients, but not everybody's hearing that out there. You got to maintain those stabilization muscles so that you're out there doing those repeated, basically single leg stances or standing on one leg over and over and over. You got to be strong enough to deal with that. Three, right? When there's pain, don't ignore it, right? I think, I'm guilty of that. I'm seeing you right now for a foot pain that's been going on for, I don't even want to tell people how many of years. And, you talked about footwear, obviously it didn't fix it, but when you got me to change my footwear, like it actually is giving me relief, right? And I know there's work to still be done. I have to keep doing the exercises like we talked about, but it was pretty wild to change my footwear, and then all of a sudden I feel better. And then last, I think, is nutrition, right? And we just briefly touched on that today, but it's so important for fueling your performance, but also keeping your body healthy. And we often, there's a duality there because, like I said, I think there's a lot of people that are running this mini marathon season, especially because everybody starts off in January and everybody wants to lose weight in January because of the new year, the resolutions. I think there's a lot of people that are doing it for that. And it might be one of the reasons that they're winding up hurt.
I think too, if you are running for weight loss and you're always in a calorie deficit, your body's going to make metabolic adaptations and it's going to conserve energy for the most vital functions. And so sometimes people run into the fact that they can't lose weight even though they're in a calorie deficit, and it's because your body's literally hanging on. If you fuel more and it has the right building blocks, it will rev up your metabolic engine, it will rev up metabolic function, and then you'll lose weight that way too. Wow. I just don't think for performance it should be a goal. Body composition should not be a goal, and it might be a secondary thing that happens. If your goal is performance, I think there's just like unsolicited advice out there too on not carb loading and eating low carb. There's like a new study that came out recently on that, and people are kind of freaking out about why you don't.
Bulking and cutting and bulking.
Yeah. Well, I just think it just depends what the goal is again. But there's a lot of misinformation on if carbs and adequate fueling actually changes your performance. And there's plenty of solid evidence that it does. So just be mindful where you're getting that information.
Simple answer is yes. Right, it does. It does. So let's tell the listeners, like, there's a lot of people out there that are experiencing all the stuff that we just talked about, and they need a little help. So how can they reach you? How can they find out more?
Well, I'm located inside of Results by Design Fitness, so in Louisville, Kentucky. My business is Foundations Physical Therapy and Wellness, so you can jump on my website and schedule there. I'm on Instagram, allieharper.dpt. I think that's what it is. Anyways,
I'll put it in the show notes for you and everything.
Just Google Foundations Physical Therapy and Wellness, and it can help that way. I do free consults, movement screens, running analysis if needed, and then blood work review as well. So kind of all pieces that we talked about today.
Cool. If any of this resonates with you, we're doing a little bit of a dual giveaway here. So if you comment "run" on any of this information on this podcast, you're going to get a free consult with Allie here, and then also a free month of personal training at Results by Design Fitness. And perhaps we can work hand in hand on helping you stay healthy for your running, stay pain-free for your running program, and maybe create a running program while also simultaneously strength training consistently with us. So if you're interested in that, just comment "run," and we will shoot all that information over to you. Scott?
Yeah, just one last thing. If you're running the Triple Crown, I mean, this is your sign, right? That you need to train smartly. We want you to be successful. We want you to be your best. So if we can help in any way, like Ryan, Dr. Allie said, please reach out.
Yep. Love you too, guys. We'll see you next time on Live Healthy Louisville.